I was on mute. Hi all.
Hello.
We're overrunning slightly in the main room. There's always so much to talk about, isn't there? So we're just having a couple of minutes comfort break if you want to pop your cameras off and grab yourselves a drink, and people should be here within the next couple of minutes.
Brilliant, thank you.
Fabulous.
Thank you, Ellie.
And sorry, Ramsey, for that very quickly typed message letting you know in the background. So we'll get started. Sian will be joining us and we'll get started in sort of 3 or 4 minutes. Hi, Sian.
Hi.
Can I just check that you can all see the slides as you're joining the workshop?
I can't even see you at the moment. Where have you gone?
Meg, can you see the slides? Yeah, perfect. Thank you. So for those of you that are just joining from the main room, we're taking a couple of minutes comfort break if you want to grab yourself a quick cup of tea or a glass of water or anything else. And then we will be getting started in sort of 2 or 3 minutes.
Oh, we're really struggling with connection here in Leeds, Ellie. Should have stayed at home.
That's fine, Sian. If you are struggling, we can hear you, but if you do start to struggle, let me know and I'll just run through your opening slides.
Fantastic. As long as the people who are presenting can get on, that's the main thing.
Yeah, we have everybody here, so that's positive. Hi all to those of you that are joining us from the main room.
Thank you so much for stepping in, Ramsey. It's great to see you.
That's all right. Yes, I was going to say, long time no see, Sian. Yeah, no, absolutely no problem. All part of teamwork, isn't it? So, like, we all know, and this is the last thing Andy would want. So,
totally.
You know, we know he's not skiving, so I'm sure even with a slight bug, he would have been here if he can. But if Andy's not working, you know it's serious. So
absolutely. I've not known him that long, but I certainly picked that much up.
But no, really happy to be here. And I think the young adult carers who I'm supporting will be here very soon. And yeah, just really glad that we're here and that there's this workshop on young carers. So thank you for organising it.
Great, thank you. So we have
Ramsey. Oh, sorry.
And then we have Meg and Tan. Is that right? Have I got your names correct? Is it Tan you'd like to be called, or Tanveer?
Tan is good, thank you.
Okay. Ellie, my camera's not working, I don't think.
We can hear you, Sian.
So I'll keep it brief. And it's probably the best thing, really. Fortunate.
We're just going to give it till 25 to, I think, to allow people to come in from the main room. Ramsey, as you were talking there, did I hear bird song in the background? I could hear some cheeping birds. You had a nice background sound.
I do, yes. I've got the window open. I will close it if it's interfering.
Absolutely not. It's a nice sound.
Yeah, there's a bird. Yeah, some birds live right outside the window. So, yeah, they just all chirp away all day. It all seeps into the background. So it's a nice reminder actually to tune into that every now and then.
Absolutely.
It is. It's lovely.
Worst background noise to a workshop.
Absolutely. Finish the session. So we're going to start soon, Ellie.
Yeah. So I think we're going to wrap up by about 20 past. Dave was asking, so we can start when anybody's ready.
Yeah, I think, shall we make a start and then we'll give Dave's challenge to be complete and back into the room by 12:20. So a very warm welcome to you all who've joined us for this this Young Carers workshop. My name is Sian Harris, and I work within the unpaid carers work stream at NHS England. And sadly, my camera is not working today. I think it's a bit too much for Wellington Place up here in Leeds to have enough bandwidth. So I think that's it. Can we have the next slide, please, Ellie? So you've seen the housekeeping previously, but just a quick reminder to say thank you. It will be recorded. If you could keep your microphones on mute during the presentation, it'd be great. Please feel free to use the chat box function to put any reflections or questions. You can enable the closed captions for subtitles during the meeting, and the recordings will be uploaded onto Futures. So next slide, please, Ellie. So this is a quick breakdown of our workshop. So the first will be over to Tan and Meg from Social Finance, and then talking about safety and data. Then we'll have Ramsey, who's picked up from Andy. So thank you very much again, with Becca and Danny around No Wrong Doors. We'll have a session for you to ask some questions and answers. And then we'll have hopefully some 5 minutes on reflections. Next slide, please. So I'm going to hand over, if that's okay, to colleagues who this is your opportunity.
Great, thanks, Sean. Yeah, so hi everyone, I'm Tan, and I'm here with Meg, who will be running us through the majority of the slides today. We're from an organisation called Social Finance. We are a not-for-profit organisation. We work across a broad set of issues. So we work across children, young people, health, employment, and also housing. And I guess just to get a bit of context as to how we came to the young carers world. So we had been working across a number of issues affecting children, young people, including violence impacting young people, school exclusions, etc. And throughout all of that, we saw this kind of common thread of young carers who had not been identified, but constantly popping up in our work. And so we kind of followed that route to understand what was going on with young carers and how might we kind of bring our approach around that. We then had a bit of funding, thankfully, from the Triangle Trust, and we did kind of 3 streams of work. We looked at the overlap of exploitation and exclusions with young carers. B, we looked at developing some kind of system level goals for the young carer sector. So looking at what the actual systemic barriers were to kind of pushing forward change in the young carer sector and what we could do to support that. And that work is ongoing. We're working with a broad set of organisations across the sector on that. And then the third, as you'll see here, is the point around safety and data. So we published a safety and data report, I think in about November last year. And this was, reflecting the fact that what we had seen across the sector was a real lack of data and information on young carers, and particularly the kind of depth and breadth of the experiences of young carers and how that manifests in the really kind of key data sets that that professionals use and practitioners use on a day-to-day basis, whether that be across social care, health, or in schools. So if we get to the next slide, please. Yeah, and I think we can skip this one as well, actually. Cool. So yeah, so the system priorities that we laid out, as I said in the kind of second work stream. 1, enhancing data use and identification and research, which of course is the system priority that we'll be talking about today. But just to kind of run you through the others were recognising young carers and their complex identities. So, for example, the overlaps of young carers and issues around kind of exclusions, violence, where they may themselves have experience in the care system, but also the different kind of identities that they may have in terms of race, gender, etc. The third one was around codifying best practice and what works, so being really clear as to what kind of best practice is in relation to supporting young carers across all these different ranges of support that they need, encouraging whole family and whole system approaches to support young carers, and tackling financial constraints and making the case financially to understand, okay, here are the clear kind of costs to the system in relation to young carers and not supporting them, and here is the kind of positive financial case to provide that support in more depth. So as I said, we work with a broad set of partners to develop those, ultimately to try and bring the sector along on this kind of like consistent view of, okay, what's the long term kind of barriers that we need to focus on as a sector. So the report will address system priority 1. And essentially, our point is that if we want to really support young carers in more depth, we need to make sure that the data we were using for identification and support is robust, representative, and also shared safely between organisations. And what we're saying is that by creating that really safe, strong data infrastructure, not only are we going to be able to kind of identify and support more young carers in the immediate term, but we'll also better understand their experiences. Next slide, please. So I guess just a bit of oh no, I think Meg, actually you're doing the slide, aren't you? Sorry, I'll hand over to you.
Thank you, Tan. Yeah, so when it comes to data, there are some fundamental challenges, and that's across local authorities, education, and health that make identifying and supporting young carers especially difficult. And this all contributes to the wider data infrastructure that can be optimized to further improve identification and support. So for local authorities, they can struggle to make the case for investing in young carers locally, and that can be due to financial pressures, that can be due to limitations in capacity, and also the statutory levers that they can rely on to make the case for funding aren't always as strong as they need to be able to secure that. In education, schools can lack the capacity for training and support of young carers, and that also is due to limited resources, and there can be an issue there with lack of awareness about young care experiences, so knowing how to identify them, knowing what kinds of support they need, etc. With health, processes aren't always in place to utilise the close proximity that health workers have to families to identify and support young carers. So, for example, community health workers that go into the homes where young carers exist. There aren't always processes and standards there to utilise those pathways and similar scenarios to that. And then lastly, data sharing across organisations. So across all three of these institutions, organisations, there can be really ineffective data sharing, and that means that young carers might have been identified by one organisation, but then they don't receive the whole system level support from the other people that are involved in their life and day-to-day care. Next slide, please. As well as institutional barriers, there are also social and cultural barriers that means young carers don't always identify themselves to authorities. One of these is a fear of statutory services. So young carers can be really hesitant to identify themselves and how much care they're providing, because they might be fearful of the perceived consequences of that, whether social services get involved and what that could mean for them, potentially removal from their family, just general fear about government involvement in their family and personal issues, and that can be even worse for young carers that are from a global majority or low-income backgrounds, where there is history of systemic discrimination when it comes to those kind of groups' involvement with the government, and additionally for someone caring for someone with mental ill health or substance misuse issues, where there can be quite a lot of stigma around living and with those conditions and parents having those conditions, and that can make it harder to come forward. Additionally, there are cultural differences when it comes to caring, being a young carer. So for some young carers, it's just a key part of their culture, and that simple label of just young carer might not be a holistic enough picture of their situation, and understanding their circumstances and kind of the tailored interventions and support that they may need, and that can lead to underreporting and lack of tailored support. Next slide, please. So we need to create a data infrastructure that allows young carers to be identified safely and supports young carers to come forward and ask for help. But the highest priority within all of this is making sure that we do it ethically and in a way where young carers, as much as they are seen, they are safe. So it's not just about collecting and sharing information, it's about making sure young carers feel safe and supported within the system. If young carers don't feel safe, then they often go unnoticed, choose not to ask for help, and that can be right when they need it most. So safeguarding well-being should always be the priority when examining this issue. And by handling this data with care, we can create solutions that genuinely improve the young carers' lives without reducing them to singularly just a data point that we need to collect to understand facts and figures about the population. So yeah, full ethical approach that ensures the support that young carers receive is personal, meaningful, and never goes beyond the barrier of intrusive. Next slide, please. And so we've identified 6 points that you can focus on to ensure that you are creating a safety first data infrastructure. First one being identification being matched with timely support. It can be really difficult for young carers to ask for help, and when they do, they should get that support straight away. If we're looking at systems and making improvements to processes to improve identification, it's crucial that they do then actually receive the support that they need. Taking a relational approach. So data ultimately is personal information about young carers, families, etc. And so therefore it does need a personal approach, and focusing solely on the processes involved in data collection, usage, sharing, etc. isn't always actually the best solution. And sometimes it's about building better relationships across organizations and even internally, and just really thinking about who is collecting the data, how they're collecting the data, and how those processes can be embedded in a more relational approach when it comes to those involved with the young carer support. Next, young carers and their families should be involved in co-designing updates to systems and processes. So we need some standardized data to understand young carer experiences at a national level, but there's also a real value in co-designing local data capture that reflects what young carers need in their own communities. We need to understand the whole family context. So understanding young carers' family context can help us know what the right support should look like. It helps us tackle the issue at its root cause instead of just the sort of symptoms, if you will. And one additional consideration we need to make with this, though, is being transparent with the family about how their data is being used, and think through the ethical considerations in doing so, as when you branch out to the whole family support, you're not solely considering how all of these processes are impacting one young person, but making that case to handle, share, and so on the data of multiple people. It's also crucial to build trust with young carers and families. So not all young carers want to be identified or receive support, as we've touched on when it comes to the social and cultural barriers when it comes to identification. Some young carers choose to stay invisible, and using data tools to find them can risk breaching their trust and overriding their consent. And then lastly, structural racism and bias needs to be tackled head on. So if we're collecting data from young carers that are wary of government, we need to acknowledge that up front. These young carers should fully understand how their data will be used, and we need to make sure we're actively challenging biases throughout that process. Next slide, please. Data infrastructure can be thought of as being composed of 3 different categories. That's data collection quality, data usage, and data sharing. So data quality can be best understood as the fitness for purpose of a data set, and that's whether the data is of high enough quality to effectively and accurately serve its purpose. Data usage in this context is about how well we use the information we collect to identify and support young carers, and that includes both data directly from young carers and the use of related data sets and tools. And then for data sharing, as we've discussed, data isn't always effectively shared between organisations, making it harder to identify and support young carers. And so that part of the process is understanding how we can optimize those data sharing processes. Can I have the next slide, please? As it's critical the right data is collected and it is of high quality. So this is about the first point in the infrastructure, data quality. So for some context on this, there are some components within data quality that are useful to look at and use when we're thinking about how to improve data quality. One is accuracy. So when data on young carers isn't accurate, policies can be misguided and resources can be wasted. Data can be inaccurate because of collection processes that aren't effective for frontline workers, or families holding back information because they don't trust statutory services, and that can leave us with an incomplete picture that doesn't reflect the real experiences the young carer and their family are having. Another factor is representation. Marginalised young carers are being overlooked in the data, and that means that they're missing out on the support that they need. So, as we spoke about previously, stigma around issues like substance misuse and mental health can make it even harder for young carers to come forward. And if we want truly inclusive support, we need to close this gap and make sure that all young carers feel seen and counted. Another factor is relevancy. So right now we're missing key details in young carer data, and that means that support isn't always hitting the mark. Things like physical health and the risk of exploitation aren't always captured when recording information on young carer circumstances and well-being, and that can make it harder to understand what they really need. So to change that, we need to build a fuller picture of their experiences when we're collecting this data, and then we can make better decisions about support and broader policy and build a more reflective national picture of the young carer population. We have some recommendations here. Ultimately, better data quality means a clearer picture of who young carers are and what they're going through. And when we truly understand their demographics and experiences, we can direct the resources where they are needed most, tailor support that actually helps, and make a stronger case for funding. One recommendation we have is working with frontline staff to find practical ways to make day-to-day data collection more accurate and complete. So frontline staff are often stretched thin, and it can be tough to make data collection a priority, especially when the value of that data collection isn't clear or the systems are too complicated. And so we need to design data processes alongside frontline staff that makes it easier for them to manage and clearly show them and work with them in understanding how it can improve support services and their day-to-day work. Another is to conduct local audits to understand existing size, quality and overlap of data sets. So data on young care is often scattered across different organisations, making it tough to fully understand young carers' needs. And so local areas should audit the data they have to spot gaps, check its quality, make sure ethical safeguards are in place. And this will help organisations work together better and create a more coordinated whole family approach. And lastly, young carers and their families should know exactly how their personal data will be used and who will have access to it. When systems are transparent like this, trust grows, and that ultimately leads to better data. So families are more willing to share when they understand how the information that they're sharing will be used and how it could benefit them. So clear and open communication, it helps remove fear around sharing information, make sure the data we collect is accurate, and of course, most importantly, leads to better support for young carers and their families. Next slide, please. When it comes to data usage, data needs to be used to support the individual and understand their wider needs. So it should be able to deliver whole family responses and provide support at an individual level. It should reflect a young carer's whole family context to provide support that is truly tailored to their needs. And when this doesn't happen, when the data is limited, we end up focusing too much on the individual young carer and miss the root causes of their experiences. So taking a whole family approach leads to a much more effective and long-term support. And data should also be used to understand trends, allocate resources, and tailor local support offers. So by using data to spot signs that a young person might be young carer, such as school absenteeism, we can identify more hidden young carers. Understanding patterns in the young carer population like this, it helps us improve how we identify and support the broader population, and it also provides better evidence to leverage for resources at both a local and national level. So recommendations for this, I'll try and whiz through them, is to explore how existing data within case management systems can be used to create a richer understanding of the experiences of young carers. For example, linking records of the adults in the family and the young carers to understand broader needs, and also contribute results of data analysis towards a national picture of young carers to build that higher population level understanding. Next slide, please. And lastly, data needs to be shared in a way that keeps young carers seen and safe. So gaining consent from young carers and families to share information can be really challenging due to reasons we've discussed about fears for sharing information, and data sharing agreements and information governance can also be really difficult to set up and time consuming. Recommendations we have around this are appointing dedicated person to manage information governance, reviewing current data processes, assessing whether they will deliver clear, tangible benefits, and this will result in more up-to-date information being shared between services that can improve timely and effective support and more comprehensive support. And I'll just hand over to Tan for the last slide.
Yep, so just kind of key takeaways. So the kind of key messages that we want to put forward here is that improving that local data is really going to help support young carers, not just in the local area, but really contribute to national understanding, improving policy, resource allocation and support. That there's a real that there's a real need to kind of focus on the breadth of the data to understand those the kind of broadness of the young carer identities, particularly around the overlapping vulnerabilities of SEND, exploitation, and caring experience. And we really want to kind of encourage that conversation around safety and data, which is I guess a concept that we've kind of landed on as the way forward to kind of really balance the need for better data, but also a need to understand, I guess, the perceived threat that many young people and many families may feel in better data. So thinking forward about how we can bring that concept of safety and data broader than just young carers as well. And yeah, of course, so if you want to kind of continue the conversation, please do get in touch with myself or Meg, and our emails are at the bottom.
Thank you so much, both of you. And I'm so sorry to bring you to a close, because you know that I could listen to your work around data and young carers all day, and you really are doing some fantastic work in this area around social finance. But I am under strict instructions from today's chair, so I am going to swiftly move us on to Ramsey, Danny and Becca. And if we could try and maybe wrap up presentations by around about 15:15, Ramsey, that would just allow us 5 minutes at the end for any questions in today's workshop.
Brilliant. Thank you very much, Ellie. So I'll be really quick. My name's Ramsey. I'm part of the policy team at Carers Trust. For those of you who don't know, Carers Trust are the infrastructure body for local care organisations. We have around 130 local care organisations in our network, all of whom support carers in their area, and we cover about 90% of local authorities. We also run something called the Young Carers Alliance, which is 200 organisations and around 800 individuals, all of whom are committed and want to find out more about supporting young carers and young adult carers. And our sort of presentation is about what's happened so far for identifying and supporting young carers across health settings, and then what we want to see in the future. More importantly than myself, we're joined by Becca and Danny, both of whom are young adult carers themselves. Danny is co-chair of a inquiry we've just launched through the APPG for young carers and young adult carers, which we provide the secretariat for, and Becca is part of our youth council who help shape our work in this area. So over to Becca and Danny, who can introduce themselves much better than I can.
Great, thank you for that, Ramsey. So I am Danny. I'm a young adult carer. I'm the co-chair and youth advisor to APPG. I'm also a student nurse and a RCN student ambassador. And just to give a little bit more context, I'm kind of creating papers, policies and strategies for young and young adult carers within the University of Nottingham and the NUH Trust, particularly around training future healthcare students about being carer aware. I'll now pass over to Becca, who will give an introduction to herself and to talk over a slide.
Hi, thank you, Danny. So I'm Becca. I'm a young adult carer. I'm 23 and I'm from Liverpool. I currently am a volunteer support worker in a community centre. I care for my mum, who was diagnosed with rheumatoid and osteoarthritis in 2024, and that caused a lot of mobility issues for her, so it's been quite an adjustment. I'm quite new to public speaking, so please bear with me with this, but it's something that I'm quite passionate about, and especially getting that awareness about how to spot a young carer, because that was a massive process for me and something I'm still coming to terms with. Next slide, please. So looking back at the NHS long-term plan, this was published back in January 2019, and it shows how the National Health Service plan to respond to medical advancements and changing health and social needs over the next 10 years. Research has shown that carers are twice as likely to suffer from poor health compared to the general population, and this is because of lack of information and support, finance concerns, stress and social isolation. So the NHS long-term plan stated that it would encourage national adoption of carers' passports, complemented by developments to electronic health records so people can share their caring status with healthcare professionals, and increased contingency planning usage so that carers don't have to deal with emergencies alone. This includes involving in educating carers on out-of-hours services that are accessible to them, along with putting backup support in place. It also included the introduction of best practice quality markers for primary care, which covers things like identification and registration, holistic support needs, and in-practice support. General practices display the declaration of being care friendly on their website, newsletter, and notice board to make carers aware, but this is work is currently being done to refresh this. So yeah, next slide, please.
Great. So young carers have a right to be involved with the hospital discharge planning. I found in my student nursing experience and speaking and reviewing over discharge policy that resources for discharge coordinators is needed, and it can vary per trust, and resources could include what carers are entitled to, as well as for supporting charities that are carer focused, such as the service for young carers, and then for adult carers, this allows a support worker to be assigned to them, can advocate for them and hold their hand every step of the way, and then giving them the entitlement forms means that they can see what support they're entitled to, such as mental health or musculoskeletal health, and then they can be empowered by choosing that themselves. They are also have the right to be involved in the integrated care board planning and commissioning for services that will affect them, and decisions about changing and developing service, as well as in the treatment, diagnosis and care for the person they care for. Over to Becca.
Next slide, please. Brilliant, thank you. As you can see from the statistics on the screen, there are many young carers who are not receiving support for their mental health. It is really important for this to be rectified for both the young carer and the person for whom they care for, because at the end of the day, a carer is a person first and is less likely to provide the best care if they're struggling themselves. Carers Trust reported that 50,000 young carers are spending as many as 50 hours a week on their caring role. Additionally, the Children's Society recognises that young carers can feel stressed or anxious feel like they're missing out on education and have limited time to spend with their friends. Social prescribing can really help with this and enable young carers to receive support for their health and well-being by attending community groups, activities and local services. And the more awareness there is within primary care, and if we improve the identification of carers, especially for those who do not necessarily align with the label a carer, especially for those who in their culture it's not, you know, they wouldn't consider themselves to be a carer, they're just looking after a family member, a sibling. So in primary care, language is something to be very mindful of. A person who requires the support of a link worker may not identify as a carer, so this is definitely something that should be taken into consideration. Next slide, please.
Fantastic, thank you for that, Becca. So over the past few years, we've seen an increasing amount of evidence on the impact of caring on the health of young carers and young adult carers, as you can see there. As Becca noted earlier, caring is a social determinant of health, making carers twice as likely to have ill health due to the lack of information and barriers to accessing support. This is particularly relevant for young carers who may not have an advocate or struggle to access more information compared to adult carers. Research from Carers UK shows that over half of carers have no idea of the support available to them under the Care Act, and therefore simply outlining what they're entitled to on forms could be a really helpful step. This could be on wards and would, if you outline the entitlements and put information on the supporting charities on there, what they can be referred to, you could hand that possibly to a patient or a carer and their family, and then that gives them power back into their own care on choosing where they can go from there and meeting them at the level they are at. So from my kind of healthcare background, I can see that you know, for codes of conduct, such as the NMC code, as well as several policies, make it a duty to ask about the children who are dependent on at home and ensure that they have the correct support, not only to fulfill their caring roles, but for their own health and safety. And now, trigger warning, this will discuss a bit about suicide and self-harm. So please protect yourself on whatever you need to do to ground yourself if it's something comes up for you. But young carers are more than twice as likely to attempt suicide as non-carers. Yet there are extended waiting times and a lack of understanding that are common barriers for young carers to access support. I propose a fast-track mental health pathway for young carers, as well as continuous workforce awareness development to avoid these barriers. Next slide, please. And it's also relevant to state that, you know, young carers are 1.5 times more likely than their peers to have a special educational need or disability. I'll allow you to look over the stats as well as I continue on. However, it's not all gloom. It is good to see that in the last comprehensive spending review, all schools will have mental health support teams, and this is one step closer to ensure that they have the support they need. At this point, I would really like to emphasize that poor health and education is really interlinked, and poor health will directly affect the capacity to learn and function, and reduced opportunities to learn and have in education will directly impact health as well. It's also important to note that the BBC and University of Nottingham research suggests that 2 pupils per classroom provide high or very high levels of care, yet 69% of schools report in the last census that there are no young carers in their cohorts, showing a mass under-identification. And this is so important to emphasise the no wrong doors pathway to ensure that no matter what organisation young carers turn to, that the MDTs have the education and awareness and support infrastructures to be able to support for young carers when they are identified. Next slide, please. Yeah, and that is, you know, the stats that I've just spoke about. I believe the next slide will be a video. What I'll hand over to Ramsey, if needed.
Danny's just shared that he can't hear the audio. Can I just check if that's everybody? You can't hear the audio.
Yeah, I can't hear it either.
Oh, so it's just me listening along to that video. Wonderful. Just bear with me 2 seconds. Let's try that again. I was enjoying it, so you're in for a treat in a moment. Okay. Ramsey, that's going to be a technical issue at our end. That's not allowing me to play the audio on that. Would you like me to skip past that slide, or would you like to have an attempt to play at your end? What I'll do, I'll skip past that slide, and then I'll share that video after today to everybody that's in the workshop. So apologies. There are perils, aren't there, of navigating an online conference.
That'd be brilliant. Thank you. I'll try and find the video as well to see if I can share it. So that video was about a hospital discharge process that didn't go to plan, which the hospital sort of acknowledged. So the video is actually recorded by the hospital itself, and it talked through the young adult carers experience there, which is why this slide is called "It's Not All Doom and Gloom." So we know that it's not doesn't always work for young adult carers, and we don't want that to be the case. We want things to work better for more young carers, young adult carers, and there are good things happening across the country. So as I mentioned earlier, Carers Trust run the Young Carers Alliance, which brings together services and individuals who either provide support to young carers and young adult carers directly, or are in a position to provide more support. So we have a local care organisation called Caring Together, and they have developed top tips for primary care, and they've turned them into mouse pads to send to all GP surgeries in their area, and created short films. They've also linked up with the ambulance service to help raise awareness of young carers. So again, that shows the really practical and simple steps that organisations and individuals can take. Top tips document, obviously produced alongside carers and then sent out to GPs there, and then also working with ambulance services. So obviously there's a whole range of services and individuals that come into contact with young carers. So actually it's really important to recognise the breadth of the organisations that do come into contact with them and work with them to make sure that young carers are on their radar, and they are sort of thinking about young carers and how they could potentially sort of identify and support them. Family Action Windsor and Maidenhead have trained over 300 health professionals across 30 different teams about identifying and supporting young carers. And at Centre 33, they've worked with their local primary care, mental health trust, school visiting and health visitor services to ensure their systems can record if someone is a young carer. In primary care, if a young adult carer has their own appointment, it pops up for the GP that person is a carer, and reminds them to check on how they're doing in relation to their caring role specifically. So again, I think those examples highlight the breadth of professionals who are potentially responsible for and may have a role in identifying and supporting young carers. And I think whilst it's a big challenge, I think it's a challenge that's really worth embracing, because actually, as Danny and Becca have sort of highlighted, the consequences of not identifying young carers and not giving them the support that they need are massive, both on their health and their education. Next slide, please.
Great. So thank you for that, Ramsey. So what we need is, as we've all stated, we need better identification, recognition, and involvement by healthcare professionals. This doesn't only mean increased awareness of what the care experience includes, but it should also be consideration with safeguarding and support for health and well-being. I'll let you read about those, but I kind of just wanted to also mention that, in my personal recommendation is, I believe that local authorities and integrated care boards should embed fiscal safety and health and MSK assessments in all young carers reviews to ensure and have an understanding of what care they're providing, and then to ensure that they have age-appropriate support, that we are preventing, reducing, and then mitigating support, and their experiences of what young carers and young adult carers face. For example, we want to make sure that we're not placing high-risk tasks on young adult carers or young children, essentially, such as dealing with controlled drugs such as morphine, or risking their musculoskeletal health. And another one of why MSK assessment should happen is carers are at the highest risk of musculoskeletal strain and an injury. And it doesn't only just affect the safety and support for the person they're caring for and the carer themselves, but it's also the leading cause of disability and workforce retirement. It can lead to ill health, an ability to engage in employment or education. As some of you may know, MSK health is actually more affected by sleep and stress, which carers and young adult carers face more prevalently. Carers also more likely to live in overcrowded living arrangements, what then affects the ability to use ergonomic support and correct manual handling. It's important to also note that we don't really want, again, to really stress that we don't really want young carers to be providing these high levels of care or high risk levels of care. So to make sure it's always age appropriate for that person, and that should be clinical judgment and have those clear guidelines. One quote that I shared was, "You can't study when you're exhausted or work when you're injured from moving and lifting your loved ones." And I think that sends a clear message. The last few notes is I appreciate the time, sorry, language is very key. As Megan said, that ethnic groups and certain kind of role identities means that many people probably don't identify with the term carer. In fact, it's on an average of 3 years that people then identify themselves as carers. So I would recommend not being hung up on the word carer and just asking, have you got any children, or have you got anyone at home that supports you? And asking those kind of open questions, and then framing for support as, this will help you guys be kind of a healthy framework around the family and to support you in what you're doing, rather than taking away from anything. And actually, one last note, sorry, is that under the Care Act, it means that carers can have anything that supports their well-being. This may include physio and OT referrals, and we as healthcare professionals will be able to then refer carers on or help them in self-referring to, let's say, through a GP to get this. And it's particularly worth to note that in my experience of speaking to healthcare professionals, many aren't aware of that. So it's really important to stress. And we need proactive early support to ensure for health and protection and well-being of young carers. Putting in this support, we can prevent further admissions and ill health. Thank you very much. Over to Ramsey.
Just really quickly, I can see Ellie staring at the time. I think just to wrap up, I think it's fair to say we have come a long way for young carers. We've seen recently DHSC sign the Carers Trust Young Carers Covenant, as well as DWP. Schools are starting to collect data within their school census. They're not recording them properly, but at least they're recording them. There's something to work with there. So we've made a lot of progress, so far, but there is more to come. And hopefully we can all work together to make that progress. And then just finally from me, thank you for listening to me, and more importantly, thank you to Becca and thank you Becca and Danny for their time and sharing their experiences and insight.
Thank you so much all, and the eagle-eyed amongst you will see that I have stepped in for Sian, who's experiencing a whole load of Wi-Fi issues up there in Leeds, but what that does mean is I am an absolutely terrible chair and have not managed to keep us to time, so we have around 1 minute left for questions. What I would like to very, very quickly do before we move on to questions is just an observation, a reflection that no matter how many times I see the stats around young carers, they never fail to catch me off guard. And you may have seen me at one point there taking a photo, Becca, of one of your slides by way of reminder for myself at a later date, because I was really surprised to see that the most common factor around social care assessments is now parental mental health. And I think that's something we really need to pick up on and be very mindful of in health and how we manage that moving forward. So does anybody have, in our very last minute, a question for either Tan and Meg at Social Finance, or Ramsey, Danny and Becca at Carers Trust? So Rebecca, I will hand over to you for what I think will have to be our only question of today's workshop.
Oh, the pressure. Just first off, well done, Danny and Becca. I've done some public speaking in my time, and I've never done it as confidently as they've done it, so absolutely brilliantly. What I wanted to do, I'm the care liaison officer at my trust, and I just wanted, while I've got you both, just to ask your advice on discharge and making sure that my discharge coordinators recognise carers. How would you feel is the best advice that I can give to them to recognise young carers?
Okay, I'll take this one. Thank you, Becca. I think it's just, well, way I speak about it too for discharge coordinators is it's not only going to impact the well-being themselves, but it's going to impact the safety and well-being of the person they're caring for. Let's say manual handling or medication or such, we need to have an understanding of what's going on for the actual protection of the well-being of the person that they're going on for, and that those support structures are in place. What I say also is for carer supporting services, they can allocate a support worker what will, rather than signpost, hopefully will hold the hands of the carers all the way along, which is very much needed. I have seen that discharge coordinators do want to generally do this, but don't normally have the resources, in my experiences, to be able to give this, and how they don't have the resources to give a better understanding. So that is a need that I see. I hope that helps.
Wonderful. Thank you, Danny. So all that leaves me to do is to say a huge thank you to Tan and Meg, Social Finance, and Ramsey, Danny and Becca at Carers Trust. For those of you back in the main room today, we'll be hearing from a young carer, Lily Durbin, who, having looked at your statistics, Danny and Becca, as you were going through, I think her presentation will really add some more life to that about what this is like for people who are providing caring tasks within the home. So thank you ever so much all, and apologies that we have slightly overrun. If you just move back into the main room by leaving this workshop, if tech works well for us, that should seamlessly glide you back into the main room. So thank you so much all.
Thank you, guys.
Thank you.